Hi,
Table Talk number 2,
number 2.
months in the making. We are really on top of things over here.
We are.
We
And
are.
there's going to be many more to come.
We're busy.
Yeah. Welcome to Table Talk with Amanda and
Dr. Dan
from
Resolve
Physical Therapy
and
Performance.
okay.
All right, welcome back. Our goals of these table talks is to have a chance to talk to each other, talk to you, on a variety of topics. We want to dig deeper into who we are, why we're doing what we're doing here at Resolve, so that you can understand why. We want to talk about, at some point, obviously what to expect, what it looks like to work with us, as well as dig into some practical scenarios.
And how we can help you.
Exactly. We want to try to give as much info as possible. We're excited.
Free content always wins.
Yeah. We're excited that it's been a year. We're celebrating our 1-year birthday here at Resolve.
Crazy.
And it's crazy. It's exciting. It's been quite a year.
Mm-hmm.
We started last February with a couple clients.
And a dream.
Hopes of developing it into something bigger. And we're excited to say we're on that track.
Yeah. Yeah, totally.
So for today's table talk, we want to just take a second and let you know what we're offering, what you can find here at Resolve, and how it can help you.
Yes.
So Dr. Dan.
Yes.
You want to give an overview of what we offer and why? Let's start there.
Sure. I think let's start with the why. I always feel like, it's a little bit more, I think, good place to start. Anyway, so why we open Resolve? Or
sure.
Yeah, okay. So this is a long story. We'll try to make it short. But simply put, the physical therapy and healthcare industry as a whole is not good, right? It's there. It's fine. We don't have to get into like all the stuff as to why. But like, being a physical therapist in a standard, traditional, in-network therapy clinic is very challenging. You're expected to see so much volume that it doesn't become about the person in front of you anymore, and it's a numbers game. And I did not want to play that game anymore.
It kind of sounds like, to me, hearing about it, there's three entities involved, perhaps.
Okay.
The PT or practitioner,
mm-hmm.
the client,
mm-hmm.
and the insurance company.
Yeah.
And it feels to me like 2 out of the 3 lose in that situation.
Yes.
Am I correct?
That's a really good. And the winner really is the insurance company.
Yeah.
Because they don't have to pay for anything, and the client gets crappy care, and the physical therapist is burnt out. So yeah. So that's a great analogy. Really well said with that.
Which you've lived.
I've lived. I would dread going to work at times, and I don't want to feel that way. I want to help people in a way in which excites me and is best for the patient.
Fun fact,
okay.
Due to being in a high-volume clinic, did you ever forget you had a patient?
Oh, yes. I told Amanda the story before. Yeah. When I first started working, this is actually when I first started working. I was a newbie working in Manhattan, and there were times where I would set someone up on heat and e-stim, right? If you know, you know. And I'd be so caught up in my next group of clients, I turned around. I was like, oh, it's been way more than 15 minutes. Luckily, that person fell asleep. I decided, hey, you needed that nap. I totally played it off like I'm sure that nap was really needed. Like, go ahead and go on with your day. We're finished up here. But it was bad. And I'm not a type of person. I'm not a good multitasker. Anyway, which most people aren't really good multitaskers inherently. That's a whole nother discussion. But
and not that is the norm.
That's not the norm. That didn't happen all the time.
People are doing the best that they can.
Yes.
In the situation that they're in.
Yeah.
However, we refuse to accept that is just what it's going to be.
Mm-hmm.
Moving forward.
For
us, at least.
Yeah. So when we decided to do something different, basically it was like, what's the model? What's a model that we can utilize or pull from or create that helps us with the one person in front of us at that moment in time? So that's obviously, we feel is a gold standard of physical therapy is like one-on-one sessions, right? I get you, there's no aids, and we get to talk about your pain. We get to talk about even more than your pain, right? What else is happening in your life that even might be contributing towards the pain or making it feel worse, especially with these like non-acute sort of like injury things when you're just dealing with chronic stuff. There's a lot more biopsychosocial factors than just like mechanical things going on. So we get a chance to do that. We get a chance to develop a program that is for you only, not like something I've given the last 10 people and print out a sheet of paper and say, like, go home and do this. Right? You get coaching. You get to ask questions.
How do you determine and design what program is best? How do you know? What's it based off of?
Well, it's based upon a very robust evaluation. Like, we spend 75 to 90 minutes just digging in on your eval, like asking lots of questions, getting the most information we can, watching you move, and like testing some things out and seeing what works and what's not going to work, and then like sending you down a path of like, this is your on-ramp, this is your entry point
to get to their goals.
To get to your goals. It's all derivatives of your goals.
Right.
And then, so we created Resolve. We had that going, one-on-one therapy programs. And then
it was awesome to hear over a period of 3 months per se the progress that people were making. So that was great. That was like, yes, this is why we're doing what we're doing. And
the question became, how do we then continue to help these people, right? Like your journey or whatever you want to call it doesn't end like at 3 months. You may feel a lot better after 3 months. That's obviously the goal, but like it's sort of like, then what? You're just gonna stop doing things, like especially for those people that didn't have a good strength and conditioning program to begin with. Like some people we see do, and they're dealing with an injury and they go back to it, and I coach on some technique and maybe some like variations. But then the people that we see that don't have that stuff is like they need the most help. So we created group training, which is 4 or 5 people at a time coming in, following a program that is done as a group, but also can be individualized towards their needs and skill set within the session. And that's been amazing. Like people have been sticking with this program, some of them for, let's see, 6-7 months now almost, that wouldn't have stuck with any other program prior for that long.
Yeah. So. And it's awesome. Some people come multiple times a week.
Yeah.
And not only is it just fun and the community is relaxed, it's not a high intensity, intimidating setting. And then some come while supplementing with other fitness. So that's been really exciting. We're pumped about this year with the hopes of growing that even more.
Yes.
We want to get more groups going, vary the times that we have them, because as we'll get into in further table talks, it's a continuum. And we are not here. We're here for you every step of the way.
Yeah. So what we also found was this is where we're at right now. Is there's still a gap in there, right, Amanda? So it's not like we've had people come in like with an injury or dealing with a persistent issue, right? And then we've taken people out of that and then introducing them to some sort of exercise, right, or movement program for them. But we realized there was like a gap of people in the middle, right? Like you've had conversations with like our children and their parents, and we're kind of in the same age category. And like, what are some of the things that like you were hearing that prompted us to sort of like make this middle ground?
Sure. I've had multiple conversations with people who one an individual asked, I'm in my 40s, like I just kind of want like an assessment of my joints. Like and he kind of was like, you don't do that, do you? I'm like, yes, we're at an age now where what we do now matters. And having guidance and coaching for that helps us feel great years to come. So that got us thinking. Then someone else was like, like my knee just like doesn't feel great when I run, but like, I guess like I'm at the age where that's just normal. That's just what it's going to be.
Yeah, I'm 40.
Right,
so like
and I'm thinking about that too. And like, that doesn't have to be. However, people like that, when they see physical therapy on our sign, even though it's and performance, your mind doesn't go to oh, I wonder if they could help us.
Yeah.
However, this is a really important group and time to address things like this. So
Yeah.
we started thinking, what is this middle ground? Oh, and one more. I had other conversations with people who started hearing about group training and thinking like, ooh, that sounds really good. But then we started realizing, you know what? Yeah, we would love for these people to join group training. However, those in training have worked with Dr. Dan for the last 3-4+ months.
Mm-hmm.
So the training, they have the foundational skills through their program that then in the transition into training makes sense and we can, move along. But then we had people who wanted to join who didn't have that foundational knowledge yet, who didn't know, certain moves and lifts. And then in order to not hold group training back and to give that person what they need
Mm-hmm.
for this foundation for hopefully the rest of their life, we also were thinking like there's got to be an on-ramp for fitness and movement
Mm-hmm.
in a safe way, in a non-intimidating way, and in a sustainable way.
Yeah. So this program we're creating called Foundations of Movement is basically a middle ground where you don't have to be in pain. You don't have to have suffered an injury, right? Yeah, you might have some like nagging things that like every time you do start to exercise like pop up, right? So that we can talk about that in our evaluation or an assessment day. And then it's like 6 weeks of here are the standards. Here are the fundamental movements of like any good strength and conditioning program. Like let's practice these. Let's make sure you own these movements. You can like learn them in here in our sessions and like go to a gym and like practice them there or at home if you have the equipment. And then as you learn these and feel really comfortable, it's like group training is the next best option. It's like, wow, I got the moves. I know what the exercises are. I can do these. I got Dr. Dan watching me doing them at this time. And you're finding like this community of people that also are enjoying fitness, and I think that's like the most important thing.
Yeah. So
yeah.
it's we're at an exciting spot
Yeah.
because only a year ago, we started with our kind of PT only type treatment, and now
And a dream.
and a dream.
Don't
we're
forget
still
that.
and we're still dreaming.
Still dreaming.
But now we have these different on ramps
Yeah.
for the continuum of care and health.
Yeah.
So to review, basically, you obviously can come in if you're feeling pain, if you have an injury,
Right. Sprained your ankle, twisted your knee, whatever.
You don't need to go to the doctor first. Like
Also
come to us,
Mm-hmm.
and that's a whole other talk we can go through. But speed up the process, and if the doctor's necessary, we will totally send you
Mm-hmm.
on your way for that first. But there's the pain entry, then there's the proactive fitness, little aches and pains, just like let me set myself up for success, and then into group training.
Yeah. So that's where we're at these days, and future table talks will be a little bit more kind of targeted towards specific topic points, questions that we've been asked. We want to update you on our business and keep you posted, because obviously our business is not a business without you guys. So for those that have worked with us, thank you, and for those that have questions about anything, even if you're not in our local community, like we do help clients virtually as well. I do believe that can be a very successful, what's I'm looking for, like a model as well. It doesn't have to all be in person. And so feel free to comment, send us a DM on Instagram. We are at resolvept.nj. Please follow us, like us, help us out. Thank you for listening.
But most importantly, do this for you. Reach out, check us out, give yourself a plan to feel your best now for yourself, for your family, for years to come. And that's why we're here. So stay tuned for more.
We'll end it there. Take care. Goodbye.